Hi there, my name is Kelsey, and today we're going to be talking about plant-based diets and chronic kidney disease. All right, so first we'll start off by defining a whole food plant-based diet. Then we'll talk about the benefits of a whole food plant-based diet, specifically how it relates to chronic kidney disease. Then we'll talk briefly about diagnosing chronic kidney disease, as well as the traditional dietary recommendations that are usually given. We'll talk briefly about some nutrients of concern in CKD, and then a little bit about personalization, and then some action steps for you. All right, so this definition of a whole food plant-based diet comes from the American College of Lifestyle Medicine. And a whole food plant-based diet is one that consists of vegetables, fruits, legumes, whole grains, nuts, and seeds. It's a diet that's high in fiber and antioxidants, and it's low in total added fat, saturated fat, added sugars, and added salt. All right, so there are many benefits of a whole food plant-based diet, but here are a few as they specifically relate to chronic kidney disease. So a whole food plant-based diet is going to produce a more alkaline environment in the body, which is important when it comes to kidney disease. It's helpful for blood pressure and blood sugar control, as well as weight management. This diet is higher in fiber, antioxidants, and polyphenols. It's often easier to follow a lower protein diet on a whole food plant-based diet. And it is higher in fiber, which reduces the uremic toxin production in the body. All right, so here are a few things briefly about diagnosing kidney disease. Now, diagnosing CKD is outside of the scope of this video, but here are just a few key points for you to keep in mind. So there are several blood and urine tests that are utilized to help diagnose chronic kidney disease. Some blood tests include the blood urea nitrogen, or the BUN, creatinine, and the GFR, or the glomerular filtration rate. And this is the rate at which your kidneys are able to filter your blood. Some urine tests include urine protein and urine albumin. Now, a general rule of thumb, if your GFR is below 60, this can indicate chronic kidney disease. And if your GFR is above 60, it would require further testing to diagnose chronic kidney disease. All right, so here are the traditional dietary recommendations that are given when someone has been diagnosed with chronic kidney disease. So the diet really emphasizes animal proteins and white grain products and really limits foods like fruit, vegetables, whole grains, beans, and legumes. And this is because those foods are naturally very high in potassium and phosphorus. So the traditional recommendations are to limit those foods so you're lessening the load of those nutrients that you're supplying the body with. Now, there are some concerns with these traditional recommendations because a diet that's focused on animal proteins and processed foods can lead to a diet that's very low in fiber and other key nutrients. So the traditional recommendations, this is not a health-promoting diet and can lead to increased risk of developing other chronic diseases like diabetes and heart disease. All right, so there are certain nutrients that are of concern when it comes to chronic kidney disease, and all of these nutrients can be addressed and managed with a whole food plant-based diet. So let's dive into some of them specifically. Protein. Protein needs change depending on which stage of CKD you're in. If you're on dialysis, you're going to need more protein than when you're not on dialysis. So on a whole food plant-based diet, eating plant protein is going to lower the potential renal acid load, as well as have less nitrogenous waste and uremic toxins. Again, beneficial for someone who has chronic kidney disease. Sodium. A whole food plant-based diet is naturally very low in sodium. And this is because a standard American diet is really usually high in processed foods, packaged foods, fast foods, which are the main culprit of salt or sodium in our diet. So even if you follow a whole food plant-based diet and you choose to cook with a salt shaker, you're still likely going to be getting way less sodium than someone following a more standard American diet. Potassium. Now, potassium is one that really requires personalization. So if your potassium levels are high, you may need a potassium restriction. So just a rule of thumb here, if you need a potassium restriction, it's recommended that you would choose lower protein, lower potassium choices most of the time. And you can focus on food preparation methods that actually can help to reduce potassium levels. And those will be described further in the article below. Phosphorus, the key with phosphorus is really how much of it is actually absorbed by the body. So phosphorus that's coming from plant foods is only about 10 to 40% absorbed, whereas phosphorus coming from animal foods or additives is usually 40 to 100% absorbed. So that's a big difference in absorption and can really give you a lot more leeway as far as how much phosphorus you're getting from plant foods. All right, so again, personalization is key here, and this is because everyone's lab values are going to be slightly different, and so some may need a potassium restriction, others may not. Some may need a phosphorus restriction, others may not. So really, this is why it's important to talk with your healthcare team to really understand if you need these restrictions or not. And again, guidelines change based slightly on the stage of CKD that you're in. So it's really hard to have a one size fits all, but for the most part, a whole food plant-based diet can be very beneficial for someone with chronic kidney disease. Again, the personalization is what is key here. All right, so here are a few action steps for you to move towards a more whole food plant-based diet if you have chronic kidney disease. So the first is to increase your fruit and your vegetable intake. Again, this must be based on your individual potassium needs. So speaking with your healthcare team to find out if you need that restriction or not is going to be key. Second, swapping animal protein for plant protein. Some plant protein examples include beans, legumes, soy, and tofu, and nuts and seeds. And third, focus on whole foods rather than processed foods. And this is really so that you avoid or eliminate those foods that have additives like added salt or added phosphorus. All right, so in the article, we will be linking a few more additional resources for chronic kidney disease. A website, Plant-Based Kidneys, has blog, recipe, and even an online course. And then we have 2 whole food plant-based sample meal plans, depending on the stage of CKD that you're in. All right, that is it for today. Thank you so much for watching.